Welcome to This Week in Medicine, your filtered medical journal summary. Looking to stay up to date with the latest medical research but short on time? This Week in Medicine has you covered. Our AI-generated podcast provides you with a convenient, on-the-go solution to keep you informed about the most significant developments in the medicine field. Each episode offers a filtered and concentrated summary of key journal articles, allowing you to stay informed without the need to sift through pages of research papers. With This Week in Medicine, listening is faster than reading, and you can consume valuable medical knowledge while commuting, exercising, or during your daily routine.
Hi, This Week in Medicine, we will be discussing. First, we will be discussing articles in New England Journal of Medicine. Asciminib in newly diagnosed chronic myeloid leukemia. Background. Patients with newly diagnosed chronic myeloid leukemia, CML, need long-term therapy with high efficacy and safety. Asciminib, a BCR-ABL1 inhibitor specifically targeting the ABL myristoyl pocket, may offer better efficacy and safety and fewer side effects than currently available frontline ATP competitive tyrosine kinase inhibitors, TKIs. Results. A total of 201 patients were assigned to receive Asciminib and 204 to receive investigator-selected TKIs. The median follow-up was 16.3 months in the Asciminib group and 15.7 months in the investigator-selected TKI group. A major molecular response at week 48 occurred in 67.7% of patients in the Asciminib group, as compared with 49.0% in the investigator-selected TKI group. Difference, 18.9 percentage points, 95% confidence interval, CI, 9.6 to 28.2. Adjusted two-sided p less than 0.001, and in 69.3% of patients in the Asciminib group, as compared with 40.2% in the Imatinib group within the Imatinib stratum. Difference, 29.6 percentage points, 95% CI, 16.9 to 42.2. Adjusted two-sided p less than 0.001. The percentage of patients with a major molecular response at week 48 was 66.0% with Asciminib and 57.8% with TKIs in the second-generation TKI stratum. Difference, 8.2 percentage points, 95% CI, minus 5.1 to 21.5. Adverse events of grade 3 or higher, and events leading to discontinuation of the trial regimen, were less frequent with Asciminib, 38.0% and 4.5%, respectively, than with Imatinib, 44.4% and 11.1%, and second-generation TKIs, 54.9% and 9.8%. Conclusions. In this trial, comparing Asciminib with investigator-selected TKIs and Imatinib, Asciminib showed superior efficacy and a favorable safety profile in patients with newly diagnosed chronic phase CML. Direct comparison between Asciminib and second-generation TKIs was not a primary objective. Plozasiran, an RNA interference agent targeting APOC3 for mixed hyperlipidemia. Background. Persons with mixed hyperlipidemia are at risk for atherosclerotic cardiovascular disease due to an elevated non-high-density lipoprotein, HDL, cholesterol level, which is driven by remnant cholesterol in triglyceride-rich lipoproteins. The metabolism and clearance of triglyceride-rich lipoproteins are downregulated through apolipoprotein C3, APOC3, mediated inhibition of lipoprotein lipase. Results. A total of 353 participants underwent randomization. At week 24, significant reductions in the fasting triglyceride level were observed with Plozasiran, with differences, as compared with placebo. In the least squares mean percent change from baseline of minus 49.8 percentage points, 95% confidence interval, CI, minus 59.0 to minus 40.6, with the 10 mg quarterly dose, minus 56.0 percentage points, 95% CI, minus 65.1 to minus 46.8, with the 25 mg quarterly dose, minus 62.4 percentage points, 95% CI, minus 71.5 to minus 53.2, with the 50 mg quarterly dose, and minus 44.2 percentage points, 95% CI, -53.4 to -35.0, with the 50 mg half-yearly dose, p less than 0.001 for all comparisons. Worsening glycemic control was observed in 10% of the participants receiving placebo, 12% of those receiving the 10 mg quarterly dose, 7% of those receiving the 25 mg quarterly dose, 20% of those receiving the 50 mg quarterly dose, and 21% of those receiving the 50 mg half-yearly dose. Conclusions. In this randomized, controlled trial involving participants with mixed hyperlipidemia, Plozasiran, as compared with placebo, significantly reduced triglyceride levels at 24 weeks. A clinical outcomes trial is warranted. Zodasiran, an RNAi therapeutic targeting ANGPTL3 for mixed hyperlipidemia. Background. Angiopoietin-like 3, ANGPTL3, inhibits lipoprotein and endothelial lipases and hepatic uptake of triglyceride-rich lipoprotein remnants. ANGPTL3 loss-of-function carriers have lower levels of triglycerides, low-density lipoprotein, LDL, cholesterol, high-density lipoprotein, HDL, cholesterol, and non-HDL cholesterol, and a lower risk of atherosclerotic cardiovascular disease than non-carriers. Zodasiran is an RNA interference, RNAi, therapy targeting expression of ANGPTL3 in the liver. Results. A total of 204 patients underwent randomization. At week 24, substantial mean dose-dependent decreases from baseline in ANGPTL3 levels were observed with Zodasiran. Difference in change versus placebo, -54 percentage points with 50 mg, -70 percentage points with 100 mg, and -74 percentage points with 200 mg, and significant dose-dependent decreases in triglyceride levels were observed. Difference in change versus placebo, -51 percentage points, -57 percentage points, and -63 percentage points respectively, p less than 0.001 for all comparisons. Other differences in change from baseline as compared with placebo included the following. For non-HDL cholesterol level, -29 percentage points with 50 mg, -29 percentage points with 100 mg, and -36 percentage points with 200 mg. For apolipoprotein B level, -19 percentage points, -15 percentage points, and -22 percentage points respectively, and for LDL cholesterol level, -16 percentage points, -14 percentage points, and -20 percentage points respectively. We observed a transient elevation in glycated hemoglobin levels in patients with pre-existing diabetes who received the highest dose of Zodasiran. Conclusions. In patients with mixed hyperlipidemia, Zodasiran was associated with significant decreases in triglyceride levels at 24 weeks. Next, we will be discussing articles from Journal of American Medical's Association Telehealth versus In-Person Early Palliative Care for Patients with Advanced Lung Cancer, a multi-site randomized clinical trial. Does early palliative care delivered via secure video versus in-person have an equivalent effect on quality of life in patients with advanced lung cancer? Findings in this randomized comparative effectiveness trial of 1,250 adults with advanced lung cancer receiving care across 22 institutions in the U.S. Patients assigned to receive early palliative care via video visits reported quality of life scores at week 24 that were equivalent to those assigned to in-person palliative care, meaning findings underscore the potential to increase access to evidence-based early palliative care through telehealth delivery. Tenecteplase versus Alteplase for patients with acute ischemic stroke. Question: is Tenecteplase non-inferior to Alteplase for patients with acute ischemic stroke, AIS, eligible for intravenous thrombolysis within 4.5 hours after stroke onset? Findings in this non-inferiority, randomized clinical trial, including 1,489 participants, a total of 72.7% of patients receiving Tenecteplase and 70.3% receiving Alteplase, achieved modified Rankin scale scores of 0 or 1, excellent functional outcome, resulting in a risk ratio of 1.03, 95% CI, 0.97 to 1.09, which met the predefined non-inferiority margin of 0.937. Meaning findings from this study support Tenecteplase as a suitable alternative to Alteplase for patients with AIS eligible for thrombolysis. Next, we will be discussing articles from Annals of Internal Medicine, Hospital Type and Resilience During COVID-19 Surges. Background: imbalances between hospital caseload and care resources that strained U.S. hospitals during the pandemic have persisted after the pandemic amid ongoing staff shortages. Understanding which hospital types were more resilient to pandemic overcrowding-related excess deaths may prioritize patient safety during future crises. Results: among 620 hospitals recording 223,380 inpatients with COVID-19 during the Delta wave, there were 208 ECMO-capable, 216 multi-ICU, 36 large, greater than or equal to 200 beds, single ICU, and 160 small, less than 200 beds, single ICU hospitals. Overall, 5,752, 23%, patients required admission to the ICU, and 34,274, 15.3%, died. The marginally adjusted probability for mortality was 5.51%, 95% CI, 4.53% to 6.50% per unit increase in the log surge index. Strain attributable mortality equals 7,375, CI, 5,936 to 8,813, or 1 in 5 COVID-19 deaths. The test for interaction showed no difference, p equals 0.32, in log surge index mortality relationship across 4 hospital types. Results were consistent after excluding transferred patients, restricting to patients with acute respiratory failure and mechanical ventilation, and using alternative strain metrics. Conclusion: comparably detrimental relationships between COVID-19 caseload and survival were seen across all hospital types, including highly advanced centers, and well beyond the pandemic's learning curve. These lessons from the pandemic heightened the need to minimize caseload surges and their effects across all hospital types during public health and staffing crises. Next, we will be discussing articles from British Medical Journal. Randomized controlled trials on radiation dose fractionation in breast cancer. Objective: to provide a comprehensive assessment of various fractionation schemes in radiation therapy for breast cancer, with a focus on side effects, cosmesis, quality of life, risks of recurrence, and survival outcomes. Results from 1754 studies, 59 articles representing 35 trials, 2,237 patients, were assessed. 21.6% of outcomes showed low risk of bias, whereas 78.4% had some concerns or high risk, particularly in outcome measurement, 47.4%. The RR for grade greater than or equal to acute radiation dermatitis for MHF, compared with CF, was 0.54, 95% CI 0.49 to 0.61, p less than 0.001, and 0.68, 0.49 to 0.93, p equals 0.02, following breast-conserving therapy and mastectomy, respectively. Hyperpigmentation and grade greater than or equal to 2 breast shrinkage were less frequent after MHF than after CF, with RRs of 0.77, 0.62 to 0.95, p equals 0.02, and 0.92, 0.85 to 0.99, p equals 0.03, respectively, in the combined breast-conserving therapy and mastectomy population. However, in the breast-conserving therapy-only trials, these differences in hyperpigmentation, RR 0.79, 0.60 to 1.03, p equals 0.08, and breast shrinkage, 0.94, 0.83 to 1.07, p equals 0.35, were not statistically significant. The RR for grade greater than or equal to 2 acute radiation dermatitis for UHF, compared with MHF, was 0.85, 0.47 to 1.55, p equals 0.60, for breast-conserving therapy and mastectomy patients combined. MHF was associated with improved cosmesis and quality of life compared with CF, whereas data on UHF were less conclusive. Survival and recurrence outcomes were similar between UHF, MHF, and CF. Conclusions: MHF shows improved safety profile, cosmesis, and quality of life compared with CF, while maintaining equivalent oncological outcomes. Fewer randomized controlled trials have compared UHF with other fractionation schedules, but its safety and oncological effectiveness seem to be similar with short-term follow-up. Given the advantages of reduced treatment time, enhanced convenience for patients, and potential cost-effectiveness, MHF and UHF should be considered as preferred options over CF in appropriate clinical settings, with further research needed to solidify these findings. Next, we will be discussing articles from Lancet. De-escalation to ticagrelor monotherapy versus 12 months of dual antiplatelet therapy in patients with and without acute coronary syndromes. Background: dual antiplatelet therapy, DAPT, for 12 months, is the standard of care after coronary stenting in patients with acute coronary syndrome, ACS. The aim of this individual patient-level meta-analysis was to summarize the evidence comparing DAPT de-escalation to ticagrelor monotherapy versus continuing DAPT for 12 months after coronary drug-eluting stent implantation. Findings: a total of 8,361 unique citations were screened, of which 610 records were considered potentially eligible during the screening of titles and abstracts. Of these, 6 trials that randomly assigned patients to ticagrelor monotherapy or DAPT were identified. De-escalation took place a median of 78 days, IQR 3192, after intervention, with a median duration of treatment of 334 days, 329-365. Among 23,256 patients in the per-protocol population, massacred in 297, Kaplan-Meier estimate 2.8%, with ticagrelor monotherapy, and 332. Kaplan-Meier estimate 3.2%, with DAPT, HR 0.91, 95%, CI 0.78, 1.07, P equals 0.0039 for non-inferiority, tau 2 less than 0.001. Among 2,407 patients in the intention to treat population, the risks of BARC3 or 5 bleeding, Kaplan-Meier estimate 0.9% versus 2.1%, HR 0.43, 95% CI 0.34 to 0.54, P less than 0.001 for superiority, tau 2 equals 0.079, and all-cause death. Kaplan-Meier estimate 0.9% versus 1.2%, 0.76. 0.59 to 0.98, P equals 0.034 for superiority, tau 2 less than 0.001, were lower, with ticagrelor monotherapy. Trial sequential analysis showed strong evidence of non-inferiority for mass and superiority for bleeding among the overall and ACS populations. The Z-curve crossed the monitoring boundaries, or the required information size, without crossing the futility boundaries or approaching the null. The treatment effects were heterogeneous by sex for mass. P interaction equals 0.041, and all-cause death, P interaction equals 0.050, indicating a possible benefit in women with ticagrelor monotherapy, and by clinical presentation for bleeding. P interaction equals 0.022, indicating a benefit in ACS, with ticagrelor monotherapy. Interpretation: our study found robust evidence that, compared with 12 months of DAPT, de-escalation to ticagrelor monotherapy does not increase ischemic risk and reduces the risk of major bleeding, especially in patients with ACS. Ticagrelor monotherapy might also be associated with a mortality benefit, particularly among women, which warrants further investigation. Next, we will be discussing articles in the field of hemato-oncology. Here are the articles from Cancer Journal for clinicians. Proportion and number of cancer cases and deaths attributable to potentially modifiable risk factors in the United States, 2019. In 2018, the authors reported estimates of the number and proportion of cancers attributable to potentially modifiable risk factors in 2014 in the United States. These data are useful for advocating for and informing cancer prevention and control. Herein, based on up-to-date relative risk and cancer occurrence data, the authors estimated the proportion and number of invasive cancer cases, excluding non-melanoma skin cancers, and deaths, overall, and for 30 cancer types among adults who were aged 30 years and older in 2019 in the United States, that were attributable to potentially modifiable risk factors. These included cigarette smoking, secondhand smoke, excess body weight, alcohol consumption, consumption of red and processed meat, low consumption of fruits and vegetables, dietary fiber, and dietary calcium, physical inactivity, ultraviolet radiation, and 7 carcinogenic infections. Numbers of cancer cases and deaths were obtained from data sources with complete national coverage, risk factor prevalence estimates from nationally representative surveys, and associated relative risks of cancer from published large-scale pooled or meta-analyses. In 2019, an estimated 40.0%, 713,340 of 1,781,649 of all incident cancers, excluding non-melanoma skin cancers, and 44.0%, 262,120 of 595,737 of all cancer deaths in adults aged 30 years and older in the United States were attributable to the evaluated risk factors. Cigarette smoking was the leading risk factor contributing to cancer cases and deaths overall, 19.3% and 28.5%, respectively, followed by excess body weight, 7.6% and 7.3%, respectively, and alcohol consumption, 5.4% and 4.1%, respectively. For 19 of 30 evaluated cancer types, more than one-half of the cancer cases and deaths were attributable to the potentially modifiable risk factors considered in this study. Lung cancer had the highest number of cancer cases, 201,660, and deaths, 122,740, attributable to evaluated risk factors, followed by female breast cancer, 83,840 cases, skin melanoma, 82,710, and colorectal cancer, 78,440, for attributable cases, and by colorectal con, 25,800 deaths, liver, 14,720, and esophageal, 13,600, cancer for attributable deaths. Large numbers of cancer cases and deaths in the United States are attributable to potentially modifiable risk factors, underscoring the potential to substantially reduce the cancer burden through broad and equitable implementation of preventive initiatives. Next, we will be discussing articles in the field of gastroenterology. Here are the articles from Clinical Gastroenterology. Endoscopic glue injection versus endoscopic human thrombin injection for bleeding gastric varices, a randomized controlled trial. Background: acute gastric variceal bleeding, AGVB, is a potentially fatal consequence of portal hypertension, accounting for 10% to 30% of all variceal bleeding. Although endoscopic cyanoacrylate glue injection is a common treatment for acute hemostasis, it has been linked to significant side effects. In the treatment of AGVB, there is limited evidence of the efficacy and relative safety of endoscopic human thrombin injection over glue injection. Conclusion: to achieve successful AGVB hemostasis, endoscopic thrombin injection has been proven efficacious. However, glue injection may be linked to a higher rate of rebleeding and post-therapy gastric variceal ulceration compared with thrombin. Next, we will be discussing articles in the field of infectious diseases. Here are the articles from Clinical Infectious Diseases. Association between social vulnerability and Streptococcus pneumoniae antimicrobial resistance in U.S. adults. Background. Growing evidence indicates antimicrobial resistance disproportionately affects individuals living in socially vulnerable areas. This study evaluated the association between the CDC/ATSDR Social Vulnerability Index, SVI, and Streptococcus pneumoniae, SP, antimicrobial resistance, AMR, in the United States. Conclusions. SES and household characteristics were the SVI themes most associated with SP, AMR. Next article. Quantifying the time to administer outpatient parenteral antimicrobial therapy. Outpatient parenteral antimicrobial therapy, OPAT, relies on substantial uncompensated provider time. In this study of a large academic OPAT program, the median amount of unbilled OPAT management time was 27 minutes per week, per OPAT course. These data should inform benchmarks in pursuing novel payment approaches for OPAT. Next, we will be discussing articles in the field of rheumatology. Here are the articles from Arthritis and Rheumatology. Diversity and epitope spreading of anti-RNA polymerase, 3 antibodies in systemic sclerosis. Objective. Epitope spreading, ESE, involving autoantibodies, plays a crucial role in the development and persistence of autoimmune reactions in various autoimmune diseases. This study aimed to investigate the relationship between ES of anti-RNA polymerase 3, BOS3, antibodies, RS, and the clinical manifestations of systemic sclerosis, SSC. Conclusion. Our findings indicate a correlation between ES levels and the severity of skin sclerosis, or the risk of other complications in SSC. This study suggests that measuring ES in SSC serves as a novel biomarker for disease activity. Here are the articles from Journal of Clinical Rheumatology. Contemporary patterns of financial toxicity among patients with rheumatologic disease in the United States. Background/objective. Rheumatologic diseases encompass a group of disabling conditions that often require expensive clinical treatments and limit an individual's ability to work and maintain a steady income. The purpose of this study was to evaluate contemporary patterns of financial toxicity among patients with rheumatologic disease and assess for any associated demographic factors. Conclusion. In this nationally representative study, we found that a substantial proportion of adults with rheumatologic disease in the United States struggled with paying their medical bills and suffered from food insecurity and CRM non-adherence. National healthcare efforts and guided public policy should be pursued to help ease the burden of financial hardship for these patients. Next, we will be discussing articles in the field of cardiology. Here are the articles from Circulation. Association of urinary metals with cardiovascular disease incidence and all-cause mortality in the multi-ethnic study of atherosclerosis, MESA background. Exposure to metals has been associated with cardiovascular disease, CVD, endpoints, and mortality, yet prospective evidence is limited beyond arsenic, cadmium, and lead. In this study, we assessed the prospective association of urinary metals with incident CVD and all-cause mortality in a racially diverse population of U.S. adults from MESA, the multi-ethnic study of atherosclerosis. Conclusions. This epidemiological study in U.S. adults indicates that urinary metal levels are associated with increased CVD risk and mortality. These findings can inform the development of novel preventive strategies to improve cardiovascular health. Here are the articles from Journals of the American College of Cardiology. Serial shock severity assessment. Within 72 hours after diagnosis, a cardiogenic shock working group report. Background. The Cardiogenic Shock Working Group, Modified Society for Cardiovascular Angiography and Interventions, CSWG-SCI. Staging was developed to risk stratify cardiogenic shock, CS, severity. Data showing progressive changes in SCI stages and outcomes are limited. Conclusions. Most patients with CS changed SCI stages within 24 hours from CS diagnosis. Stage B patients were at high risk of worsening shock severity by 24 hours, associated with excess mortality. Early CS recognition and serial assessment may improve risk stratification. From JAMA Cardiology. Neighborhood social vulnerability and premature cardiovascular disease in Haiti. Question: what is the association between neighborhood social vulnerability and cardiovascular disease in an urban setting in Haiti? Findings in this population-based cohort study of 2,925 residents in urban Haiti, among whom 70.2% reported living in extreme poverty, the prevalence of hypertension and heart failure was greatest in the individuals living in the most socially vulnerable neighborhoods. The association with living in the highest vulnerability neighborhoods was greatest in young adults and women, meaning in Haiti, the most impoverished country in the Western Hemisphere, differences in poverty and social vulnerability were associated with a higher prevalence of hypertension and heart failure. Next, we will be discussing articles in the field of endocrinology. Here are the articles from Journal of Clinical Endocrinology and Metabolism. Moderate intensity combined training induces lipidomic changes in individuals with obesity and type 2 diabetes. Context: alterations in the lipid metabolism are linked to metabolic disorders such as insulin resistance, IR, obesity, and type 2 diabetes, T2D. Regular exercise, particularly combined training, CT, is a well-known non-pharmacological treatment that combines aerobic, AT, and resistance, RT, training benefits. However, it is unclear whether moderate intensity exercise, without dietary intervention, induces changes in lipid metabolism to promote a healthy lipidome. Objective: the study aimed to investigate the effect of 16 weeks of CT on plasma and white adipose tissue in both sexes, middle-aged individuals with normal weight, obesity, OB, and T2D, using an ultra-high-performance liquid chromatography mass spectrometry, UPLE-KMS, untargeted lipidomics approach. Conclusion: our study revealed that 16 weeks of moderate intensity CT remodeled the lipid metabolism in OB and T2D individuals, even without dietary intervention, establishing a link between exercise-modulated lipid markers and mechanisms that reduce IR and obesity-related comorbidities. Here are the articles from Diabetes Care. Circulating metabolite biomarkers of glycemic control in youth-onset type 2 diabetes. Objective: we aimed to identify metabolites associated with loss of glycemic control in youth-onset type 2 diabetes. Conclusions: metabolomics provides insight into circulating small molecules associated with loss of glycemic control and may highlight metabolic pathways contributing to treatment failure in youth-onset diabetes. Next, we will be discussing articles in the field of neurology. Here are the articles from Neurology. Timing of anticoagulation, resumption and risk of ischemic and hemorrhagic complications in patients with ICH and mechanical heart valves. Background and objectives. In patients with mechanical heart valves and recent intracranial hemorrhage, ICH, clinicians need to balance the risk of an thromboembolism during the period of anticoagulation and the risk of hematoma expansion on anticoagulation. The optimal timing of anticoagulation resumption is unknown. We aimed to investigate the relationship between reversal therapy and ischemic stroke, between duration of anticoagulation and risk of ischemic prime strokes or systemic embolism, and between timing of anticoagulation resumption and risk of rebleeding and ICH expansion. Discussion: withholding anticoagulation for at least 7 days after ICH may be safe in patients with mechanical heart valves. Heparin bridging during anticoagulation resumption may be associated with increased risk of bleeding. Next, we will be discussing articles in the field of pulmonary and critical care. Here are the articles from Chest. Nationwide increasing incidence of non-tuberculous mycobacterial diseases among adults in Denmark. Background: the epidemiology of non-tuberculous mycobacteria, NTM, infections is not well described. In this study, we sought to determine the incidence and prevalence of NTM infections and focus on social risk factors. In addition, we describe people with pulmonary and extrapulmonary NTM. Research question: what are the incidence and prevalence of NTM in Denmark, and what are the characteristics of the affected patients? Interpretation: this study indicates that the prevalence of NTM disease in Denmark increased between 2000 and 2017. We found that patients with pulmonary NTM and patients with extrapulmonary NTM represent two distinct groups that differ in age, sex, education, and employment status. Increased suspicion of pulmonary NTM disease is warranted in older adults after exclusion of more common lung infections. Here are the articles from the American Journal of Respiratory and Critical Care Medicine. Susceptible young adults and development of chronic obstructive pulmonary disease later in life. Rationale: chronic obstructive pulmonary disease, COPD, has its origin in early life, and the Global Initiative for Chronic Obstructive Lung Disease, GOLD, proposes a pre-disease state termed pre-COPD. Objectives: we tested the hypothesis that susceptible young adults identified with chronic bronchitis and subtle lung function impairment will develop COPD later in life. Conclusions: our study suggests the existence of a pre-disease state of COPD, which can be used for early identification of susceptible individuals at risk for COPD later in life. Next, we will be discussing articles in the field of nephrology. Here are the articles from Clinical Journal of American Society of Nephrology. Sodium bicarbonate treatment and clinical outcomes in chronic kidney disease with metabolic acidosis. A meta-analysis keypoints sodium bicarbonate for patients with CKD and metabolic acidosis leads to a significant improvement in kidney function. Treatment with sodium bicarbonate increases in mid-arm muscle circumference, indicating a positive effect on enhancing muscle mass. Sodium bicarbonate supplementation is associated with a higher risk of elevated systolic BP, marking a potential side effect. Here are the articles from Kidney International Reports. Randomized controlled trial, comparing automated peritoneal dialysis and hemodialysis for urgent start dialysis in ESRD introduction. Peritoneal dialysis, PD, shows promise for urgent start dialysis in end-stage renal disease, ESRD, with automated PD, APD, having advantages. However, there is limited multicenter randomized controlled trial, RCT, evidence comparing APD with temporary hemodialysis, HD, for this indication in China. Conclusion: for patients with ESRD needing urgent initiation of dialysis, APD was associated with a lower incidence of dialysis-related complications and lower initial hospitalization costs compared with HD, with no significant differences in PD catheter survival rate, peritonitis-free survival rates, or patient survival rates. These findings can guide clinical decision-making for the optimal dialysis modality for patients requiring urgent dialysis initiation.
Thank you for listening to This Week in Medicine, your filtered medical journal summary. Have a great week ahead, stay blessed and be humane.